Hey folks, it's Patriot Nurse. Thanks for joining me today. In this very important video, we're going to discuss an extremely timely question, and that is what you must know before you take your child to a doctor nowadays. This video is coming right on the heels of Abomination Month and a Fornication Month, which I will not call it by its more politically correct nuanced names. Let's call it what it is biblically. The issue that has surfaced in recent times, particularly in the past few weeks, is that of medical organizations such as the AMA, which is the American Medical Association, and also the American Academy of Pediatrics. These are two prominent organizations that represent physicians at large, both in broad practice and also in the specialty of pediatrics. In recent times, there have been increasingly more and more moves, not only against freedom and against constitutional principles, but now it has become so overt and so in your face with the political agenda that these organizations are setting that it really bears considering their positions before you take your child to see a doctor who is affiliated with or a member of these organizations. So recently, in the past few weeks, the American Medical Association and also the American Academy of Pediatrics have come out strengthening their position of affirming transgender care for children, for minors. And this is extremely problematic because, number one, the quote-unquote evidence and science that they are concocting is the same type of science that, for instance, the sugar industry used to substantiate its case that sugar prevented diabetes not so very long ago, or quack doctors who said that smoking quantities of cigarettes was going to give you better health back in the day for the tobacco industry. Whenever there is a political position to be met, you can be sure that these organizations are going to front it. And the American Medical Association, as well as the American Academy of Pediatrics, have done very, very well over the past several, really, decades in slowly pushing forward their subterfuge and their agenda of the destruction of the family, and also an anti-freedom, pro-tyranny, pro-totalitarianism agenda. They were, over the past several years with COVID, hand in glove with vaccine mandates. They were hand in glove with forcing and with cajoling and for blackmailing parents into making healthcare decisions that were against their better interest and really against their own better judgment. Why this matters now in particular? Because the American Academy of Pediatrics and also the AMA over this past month have taken a much more vocal stand, where essentially what they're advocating for is that physicians facilitate gender confusion of children, which is a mental illness, and also that physicians play along with this, which troubles me personally as a freedom-minded individual, but more so specifically because of my clinical background in pediatric psychology. I worked for several years in an inpatient psychiatric hospital setting, and my core unit was an adolescent and pediatric nurse. That was what my main job was, my main gig was for several years. One thing that is not very well known, and why this is directly germane to parents before you take your children in to see physicians who are associated with these alphabet soup organizations. These alphabet soup organizations are advocacy groups, and by default of their advocacy and of their consensus building, they get together in an intellectual circle jerk and now a political circle jerk, and they basically set the protocols which later form the basis for standards of care, which ultimately form the basis for insurance compensation and also the protocols that are established. So when these organizations like the American Academy of Pediatrics and the American Medical Association put out their dictates, it behooves us to pay attention. They've done this previously in their advocacy for preventing gun violence, wherein they started pushing for physicians routinely in their entry assessments, asking children, asking families, by the way, asking children without their parents' consent and in the room, how many firearms do they have in the house? And do they feel safe? Do mommy and daddy spank you? Very invasive questions that are designed to, number one, use parents as an informing tool, use patients, children, pediatric patients, as informant tools against their parents, but also as an arm functionally of the Democrat Party and of the leftist godless agenda that we are combating right now. Before you take your children to see the doctor, if it is a relationship that is ongoing, I would encourage you to evaluate whether or not your child's physician or your physician, your family healthcare provider, is a member of these organizations. Because they may be individually not holding on that same level. But you have to recognize that they are being influenced by the journals that they're reading. They are being influenced by the positions that these organizations adopt. And if you are going to foster a relationship with a doctor, you need to recognize that you are not on equal footing with them. When I say you're not on equal footing, there is by default in the white coat medical industrial complex a power vacuum that exists between the healthcare provider and the patient. This has shifted drastically since I was in nursing school many a moon ago. But now what has happened is that these organizations, whether it's firearms related or transgender affirming care, gender fluid affirming care, we're going to facilitate whatever mental illness you're dealing with and call it normal instead of getting you help. We're going to play in your norm, play in your delusion, and potentially facilitate the mutilation of children, the chemical castration of children, and the biological destruction of those children. Before you take your child in to see these people, you have to understand now, if they are aligning with this position, whether they're actively participating in it or passively complying with it, this is where their reference is. Which means then that if you have a child that's going in to be seen and your child is at a point in life where they are stressed, where they are struggling, where they are unsure of themselves, which happens around puberty and also early on before puberty. Transition points and stress points often cause children to deal with various things, body integrity issues notwithstanding. If you are put in a position of powerlessness where the physician ultimately has the authority to report you to DCS, to report you to various governmental organizations for not affirming your child's adopted, transient, confused state. If you're putting yourself in a position like this with a physician who is associated with these different organizations, you're potentially setting yourself up and your family up for problems. Now, I'm the last person to say to discourage people from seeking health care particularly in emergency situations. I would never discourage someone from doing that. What I'm talking about, though, and I think it is very important to cover here, is instead of this Pollyannish worldview of hoping that a physician is going to care about you. There may be isolated people who are like that, but the world and the industry have transformed since the good old days. Unfortunately, the medical industrial complex, especially now that the old school docs have aged out or retired out, it is being staffed by party loyalists, diehard communists, and people who are dedicated to destroying biblical values and the foundational principles upon which our constitutional republic was formed. And the way that they are participating in it is by implementing the dictates of organizations like the aforementioned, who are sold out to party narratives of godlessness and everything else which we've previously stated. If you put yourself into their power grid, you're going to lose. Whether it is them influencing your children in a private setting and asking your child pointed questions, whether it's about how many firearms are in the house or whether they identify as transgender fluid and if they would like more information about their sexuality and have they ever kissed someone of their same gender or have they ever been interested in exploring, you can bet that this is going to be drastic and transformative to a very negative degree. So the so what factor here. Before you participate in healthcare, let me encourage you to recognize the givens before you enter into their grid. Number one, you are at a power disadvantage. Every time that you put yourself in that grid, you are exposing yourself to people who have every political incentive to inform on you and to use the letters after their name and the coats that they wear to control your health choices and to herd you like cattle into the car of their political box. Also, whether it is you choose to selectively apply their advice or you choose to be more hands-off, in the days to come, people who are going to stand on biblical principles are, in my opinion, based on the dictates from these groups and the trajectory that I have seen over the past over decade and a half of being in the medical field, what I have seen over the past several years has me very, very concerned. And it's important for us to ask a question here. In the midst of all of the consumer boycotts that have arisen over the past fornication month and depravity month, is it then logical for us to look at the same situation with our doctors as consumers of healthcare? You have a choice which doctor you go and see to a great degree. You have a choice whether or not you choose to use their services. If you have a choice, then why would you choose a doctor who is associated with these groups? Perhaps they don't know. But then if you try and bring it up to them and educate them, all that's going to do is make it look like you're a pot stirrer, a problem patient. So I see in the days coming, what's going to happen more and more is that people are going to boycott the medical industrial complex. And what that means is instead of not going to Target or not buying Budweiser, we're not buying your services, white coat world. We're not buying it. Because first off, your fundamental assumptions about many things are flawed. And then secondarily, your outcomes really suck. And then on the third level, tertiarily, you're completely bought out by this leftist agenda. Why in the world would I subject myself to that? It's a bad deal. In order for us to be able to stand firmly and resolutely, we have to be able to self-supply what we boycott. That means then, if you don't want your children exposed to these practitioners and this dogma that is informing them, you must become the healthcare provider for your family, which means you have to own the responsibility of self-sufficiency in healthcare. Returning to the days of Dr. Mom. That's scary for a lot of people, but it needs to happen. I don't want 1 cent of my money going to support anything associated with these wicked and vile groups. I've never been a part of the American Association of Nurses, the American Nurses Association myself, the ANA. From the time that I was knee-high to a grasshopper in the nursing world, I never was a part of them because I knew who they were. I knew what they stood for. They're a bunch of communist dirtbags. Healthcare providers who are part of this have a choice as to whether or not they're going to continue to pay dues and continue to be part of this organization. You, as the consumer, have a large degree of sway over this. If you find out that your doctor is part of this and is on board with this agenda, I'd be walking and finding another doctor. I don't want that influencing my family. No, the only way that we're going to be able to insulate ourselves from this chaos and this depravity is to create and be self-sufficient, to create our own island, to create our own tribe. Educating yourself and being more self-sufficient in healthcare is part of it. So friends, what we discussed today is really the depravity of the American Medical Association and also the American Academy of Pediatrics. And of course, the next step in the way that they have sought to implement their leftist and woke agenda. This is just another layer in it. The point is, to this video that I want to drive home to you, you have a choice with where you spend your money. If you don't want to buy Target and you don't want to buy Budweiser, why in the world would you spend money with physicians who are part of organizations who support this nonsense? You have a choice. And if your physician or healthcare provider is a part of this, then ask them why. Why? Why would you be part of this? Is it really that great of an organization that you're willing to support that? No. Voting with your feet and voting with your dollar also goes into the medical world. We got to be more self-sufficient. That's what I got for y'all today. I hope the video was helpful for you today. If you did enjoy the video, I hope you'll subscribe to me here on YouTube, Patriot Nurse. You can also support me on Patreon, Subscribestar, Cryptocurrency, and PayPal. I got links below. I actually have a happy announcement. I am now a master herbalist. So after several years of work, I have my master's in herbology, and now I also have my master herbalist cert. And so I'm really excited about that because it allows me to offer a new level of curriculum. It also was transformative for me as a healthcare provider, coming from the white coat world, and then over the years, learning a different way of thinking, and in my opinion, a superior way of thinking for pretty much everything except for trauma and neurosurgery. The herbal world has got it. So if you want to train with me online, I have a 4-hour course. It's $129. You can find that link down below. And also, if you'd like to train with me in person, I have some limited availability this year for the Knoxville, Tennessee class. And that class actually is going to be in August. So that's going to be, I think, the last time that you're going to be able to train with me this year. So hope the video was helpful for y'all. Hope you have a very blessed weekend. For now, it's Patriot Nurse signing off, and I'll see y'all later. Bye.